Living with cancer while undergoing radical therapies can oftentimes lead to a poor quality of life. To find out how naturopathic doctors can aid in a better quality of life, we spoke with patients and doctors in the Southwest, beginning with Dr. Simon Barker.
Quality of life varies a great deal in a patient with cancer, and how I see my job is making that quality of life as good as possible, and that is an important factor. I spend a lot of time working on these issues with cancer patients, whether they are cancer-free and looking to prevent a recurrence, or if they have active cancer which we're trying to work to keep at bay or eliminate. And quality of life is a factor that isn't always taken into consideration when we look at treatment, because a lot of the treatments can be effective in treating cancer, reducing the size of tumors and so forth, but can cause significant problems in terms of quality of life for patients. And so we want to focus our energy on making sure that, of course, we want increased length of life for patients, but not absolutely to the exclusion of their quality of life. And focusing on quality of life is very important in naturopathic medicine broadly, but certainly in terms of working with patients who have cancer.
Well, even before I had the cancer, for several years, I just was not feeling well. I knew that something was wrong with me somewhere, even before I was diagnosed. And then, of course, after I was diagnosed with cancer, I was really scared. And then especially after the surgery, when they told me, now you have to have chemotherapy and radiation and all these things, and maybe even hormone replacement. And it just all was very confusing and very scary. And, I didn't know if I would survive. And now I feel like I'm in control. I don't need to do these things that are just going to be damaging to my body. I can do, natural approaches that will help me. And, now I feel confident and I feel like I'm in control of my health.
The bottom line is I'm alive. That's a miracle. The fact that you and I are sitting here having a conversation is an absolute miracle. Statistics overwhelmingly are that I should be dead right now. Given that I had a stage 3 squamous cell lung cancer that apparently had returned a year later, I should be dead. But I'm not. And I'm not saying anything against traditional medicine. But the naturopathic care was definitely a great compliment to the care I was receiving. What I found wonderful about naturopathic care is the whole approach of it. It seems with traditional medicine, with most of my doctors, and again they were wonderful, some of the best in the state, but they tended to treat me like a blob of protoplasm. I was a human being, I walked in there, I had a disease, and so they wanted to treat the symptoms and they wanted to treat the disease. What I found in naturopathic care was, I guess, call it a very holistic approach that they took, because they were looking at me as much more. I was an emotional being, I was a spiritual being, I was an intellectual being, I was a physical being. And so it was total care. There was a sense that, yes, the body can care for itself. I'm very much a naturalist to begin with. I love the outdoors. I'm a Sierra Club member. I believe in the ability of nature and natural body functions to heal. And that's what naturopathic medicine was all about. I'll give you a great example with my neurologist, who was just outstanding physician. But when I had this LEMS disease, it is actually an autoimmune disease. And what was happening is my body was attacking the cancer. So my body was doing what it was supposed to be, even though I had the negative side effect of being in a wheelchair, unable to walk. The doctor, the neurologist, he wanted to immediately start me on steroids and go after and attack this autoimmune disease. And I said, no, wait a minute, I got cancer in my body. There's this great battle going on. Let's let it go on. Hold off on the steroids until we get the cancer out of my body. And I think the naturopathic approach is, yes, recognize that the body does heal and mend itself. And so everything I received was to look at diet, to look at exercise. They went into relationship issues with me. It was even beyond how many doctors ever cared what my social life was like. How many doctors ever really cared what was happening between my relationship with my wife and my children. Naturopathic medicine did that. It was a holistic approach to my healing.
It's family medicine. Oncology care is family medicine. In my opinion, it's impossible to practice medicine with oncology patients and not have a relationship with the family and not understand how the family members, primary family members, are responding and reacting.
Naturopathic care has given me more hope in my fight against cancer. I'm actually convinced that the cancer will not return because it's been almost 5 years. So it's more than just hope. I'm convinced that it has worked and it will continue to work. If I stay on the good diet and take my supplements, I know I'll stay healthy.